Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic shall be medicine of hand washing. Hand washing is so simple that you want to say, what do you mean by medicine? Medicine is that thing that helps to eradicate germs and other things so that we can always keep ourselves healthy. So I titled it medicine of hand washing. Generally, when you don't feel dirty, you don't want to wash. For example, I remember when in Jos with my other colleagues, we used to hang our shirt and trouser every day when we come from work. Whereas when you compare the weather in Lagos, in tropical areas, you find that the moment you return from work, your cloth, your dresses, your whatever you put on is full of the neck. When you look at the neck region, it's already stained and dirty. If you now smell the armpit, it's also the same. So you want to wash such clothes. But in climate weather, you look at the neck, even after wearing the cloth for a whole week, it is not stained, it is not dirty, the armpit. So the same thing goes, that when you look at your hand, you feel that it is not dirty. But when we culture it in the lab, you will know that you have also many germs. And that's one of the ways that we transfer diseases. And I'm sure COVID-19 measures that to prevent COVID-19 help emphasize the hand washing. And hand washing is something that helps to reduce germ level. So the full details of what we stand to gain from hand washing as medicine for good health, it's as you follow me in the slide section. Like I always say, click the like button, subscribe, and more information will come your way.
The outline. Objective: demonstration of effective ways of washing and hand washing, laboratory findings, and finally conclusion. The objective: to help in stemming down the prevalence of communicable diseases in our community by exposing the medicinal role of hand washing.
Just washing, use it, the soap, you let it enter your fingers, and then you go round, rotate the soap. This goes in everywhere. You wash it and it goes on. Then the next thing is open the tap. Use the same way. You can see the dirt coming out. And when you wash it, you have reduced the number of germs that you can transfer to yourself, to your food, to anybody, even when you shake hands. So don't be afraid of even saying the peace of the Lord be with you. Because after the mass, you can also wash your hands. And it's free. The facilities use the soap and then the dryer. This is the dryer here. Look at the dryer. Thanks. That's the moment of understanding that we need to wash hands almost every time we have the opportunity to wash it.
Yeah, caution. From laboratory findings, liquid soap is more effective than tablet soap in effectively reducing the population of microbes on your hand. When you put your hands on the railings, the cloths, or shake hands and what have you, the microbes are in the hair and automatically they are on your hand. So whether you shook somebody's hand or you touch anywhere, it is immaterial. You will always have microbes in your hands because they are everywhere. But the best soap is the liquid soap. This is because tablets are not effectively washed off and their residue are supportive of microbial growth. If there are no hand dryers after you finish washing, wave your hand in the hair to dry it up instead of drying with public napkin that may contain more hazardous microbes, or it will always contain germs anyway. Laboratory finding. 1. Hand washing is recognized and accepted as a low-cost and effective technique for preventing communicable diseases. You can confirm from Global Hand Washing Partnership. It's a handbook. And 2, hand washing was influenced by children grade level. That's another study. It also was influenced by their residents, whether they live in upper area or high density areas. Their reference, that is those who they look up to as role models that are always washing their hands, and presence of hand washing facilities, access to water and soap, and membership of WASH, Water Sanitation and Hygiene Club. That's the reference of these people. But from that, you could understand that third world countries or developing countries may have this problem of access to water and soap. And so it's so easy to even conclude why these diarrhea and other infections are so endemic in all these developing countries. Number 3, research suggests that hand washing with soap can reduce diarrhea episodes by 28 to 47% and can reduce acute respiratory infection such as pneumonia by 20 to 50%. These are common problems that really affect children and even increase their infant mortality in developing countries. That's the study finding of Curtis and co. Effect of washing hands with soap on diarrhea risk, published in Lancet. And hand hygiene with alcohol-based sanitizers or soap and water is a core element of patient safety and single most important procedure for prevention and control of healthcare associated infection. When you look at health care provider, that is worker professionals, they are always having their hands on surfaces, patients and what have you. And that is doing that they really transfer infection even to themselves and to other places. So it's a very important information. Finally, conclusion. By way of conclusion, you will agree with WHO, World Health Organization, on water sanitation and hygiene as a veritable tool, a technique for reducing infant mortality of communicable diseases. And also, you will agree with me that thinking of hand washing as daily medicine, we create that consciousness, the necessary consciousness in people so that they can wash their hands more. As research has shown that those who really wash their hands have in a way reduce these diseases, communicable diseases. So we need to broadcast this to more people living in developing country and even to the government to provide potable water, soap, and what these would help to sanitize and improve the hygienic condition in the surrounding. If you like my presentation, please subscribe and watch more very interesting health videos. I've posted almost 150. I think this will be the 149th video on regular weekly basis. Thank you for watching.